Question 1. A 55-year-old male presents with a gradually enlarging scrotal mass that transilluminates. The mass can be reduced into the abdomen with gentle pressure but reappears when the patient stands. What is the most likely diagnosis? A. Hydrocele B. Spermatocele C. Testicular cancer D. Epididymitis E. Varicocele. Answer E. Varicocele. Explanation: the description of a scrotal mass that transilluminates and can be reduced with pressure but reappears upon standing is suggestive of a varicocele, choice E, which is a dilation of the pampiniform plexus of veins within the scrotum. Question 2. A 30-year-old male presents with sudden onset, severe testicular pain that began a few hours ago. On examination, the testicle is tender, swollen, and elevated compared to the contralateral side. What is the most likely diagnosis? A. Testicular torsion B. Epididymitis C. Orchitis D. Varicocele E. Hydrocele. Answer A. Testicular torsion. Explanation: the presentation of sudden onset, severe testicular pain with tenderness, swelling, and testicular elevation is highly suggestive of testicular torsion, choice A, which is a urologic emergency. Epididymitis, choice B, may cause testicular pain but is typically associated with a more gradual onset and fever. Orchitis, choice C, may also cause testicular pain but often presents with systemic symptoms. Varicocele, choice D, and hydrocele, choice E, are not typically associated with sudden onset severe pain. Question 3. A 28-year-old male presents with a new onset, painless lump in the scrotum that feels like a bag of worms. On examination, the lump disappears when the patient lies down and reappears upon standing. What is the most likely diagnosis? A. Hydrocele B. Spermatocele C. Testicular cancer D. Varicocele E. Epididymitis. Answer D. Varicocele. Explanation: the description of a painless lump in the scrotum that feels like a bag of worms and disappears when the patient lies down but reappears upon standing is characteristic of a varicocele, choice D, which is a dilation of the pampiniform plexus of veins within the scrotum. Question 4. A 22-year-old sexually active female presents with lower abdominal pain and a fever of 101 degrees Fahrenheit, 38.3 degrees Celsius. On pelvic examination, there is cervical motion tenderness and bilateral adnexal tenderness. What is the most likely diagnosis? A. Ovarian cyst B. Ectopic pregnancy C. Pelvic inflammatory disease, PID D. Endometriosis E. Mittelschmerz. Answer C. Pelvic inflammatory disease, PID. Explanation: the patient's presentation of lower abdominal pain, fever, cervical motion tenderness, and bilateral adnexal tenderness is highly suggestive of pelvic inflammatory disease, PID, choice C, which is often caused by ascending infection with sexually transmitted organisms. Question 5. A 32-year-old male presents with a burning sensation during urination and a urethral discharge. On examination, there is no tenderness or swelling of the testicles. What is the most likely causative organism? A. Chlamydia trachomatis B. Neisseria gonorrhoeae C. Escherichia coli D. Mycoplasma genitalium E. Herpes simplex virus, HSV. Answer A. Chlamydia trachomatis. Explanation: the patient's presentation of a burning sensation during urination and a urethral discharge without tenderness or testicular swelling is suggestive of chlamydial urethritis, choice A. Neisseria gonorrhoeae, choice B, can also cause similar symptoms. Choices C. Escherichia coli, D. Mycoplasma genitalium, and E. Herpes simplex virus may cause urethritis but typically have different clinical features. Scenario 6. A 25-year-old sexually active female presents with lower abdominal pain and cervical motion tenderness on pelvic examination. She is diagnosed with pelvic inflammatory disease, PID. What is the most appropriate initial treatment? A. Oral doxycycline and oral metronidazole. B. Intravenous ceftriaxone and oral doxycycline. C. Oral ciprofloxacin and oral metronidazole. D. Intravenous vancomycin and oral azithromycin. E. Oral amoxicillin clavulanate. Answer: B. Intravenous ceftriaxone and oral doxycycline. Explanation: the most appropriate initial treatment for PID is intravenous ceftriaxone, to cover for possible gonococcal infection, and oral doxycycline, to cover for chlamydial infection. Choice B. This combination provides broad coverage for the most common pathogens associated with PID. Scenario 7. A 45-year-old male presents with a painful, erythematous, swollen right testicle. On examination, the right testicle is tender, and the scrotum is erythematous. What is the initial management? A. Emergency surgical exploration. B. Intravenous antibiotics. C. Scrotal ultrasound. D. Elevation of the scrotum. E. Immediate drainage of the scrotal fluid. Answer: C. Scrotal ultrasound. Explanation: the initial management of a patient with a painful, erythematous, swollen testicle is to perform a scrotal ultrasound. Choice C. To differentiate between testicular torsion and epididymo-orchitis. Emergent surgical exploration. Choice A. May be necessary if testicular torsion is confirmed. Intravenous antibiotics. Choice B. Are typically used in the treatment of epididymo-orchitis. Elevation of the scrotum. Choice D. And immediate drainage. Choice E. Are not indicated in the initial evaluation. Scenario 8. A 35-year-old male presents with urinary urgency, frequency, and burning. He has a history of recurrent urinary tract infections, UTIs. What is the most appropriate initial treatment? A. Oral ciprofloxacin. B. Intravenous ceftriaxone. C. Oral nitrofurantoin. D. Oral amoxicillin clavulanate. E. Urinalysis and urine culture. Answer: E. Urinalysis and urine culture. Explanation: the most appropriate initial step in the evaluation of a patient with urinary symptoms and a history of recurrent UTIs is to perform a urinalysis and urine culture. Choice E. To confirm the diagnosis and identify the causative organism. Treatment should be based on the culture results. Scenario 9. A 28-year-old male with a history of sexually transmitted infections, STIs, presents with painful genital ulcers and inguinal lymphadenopathy. What is the most likely causative organism, and what is the initial treatment? A. Herpes simplex virus, HSV, oral acyclovir. B. Treponema pallidum, syphilis, intramuscular benzathine penicillin GC, Haemophilus ducreyi, chancroid, oral azithromycin. D. Chlamydia trachomatis, lymphogranuloma venereum, oral doxycycline. E. Neisseria gonorrhoeae, gonorrhea, intramuscular ceftriaxone. Answer: A. Herpes simplex virus, HSV, oral acyclovir. Explanation: the presentation of painful genital ulcers and inguinal lymphadenopathy is highly suggestive of genital herpes caused by herpes simplex virus, HSV. The initial treatment for HSV is oral acyclovir. Choice A. Scenario 10. A 50-year-old male presents with a sudden onset, painful, swollen scrotum. On examination, the right testicle is tender, elevated, and has a transverse lie. What is the initial management? A. Intravenous antibiotics. B. Scrotal ultrasound. C. Analgesia and scrotal elevation. D. Immediate surgical exploration. E. Ice pack application to the scrotum. Answer: D. Immediate surgical exploration. Explanation: the presentation of a sudden onset, painful, swollen testicle with a transverse lie is highly concerning for testicular torsion, which is a surgical emergency. The initial management is immediate surgical exploration, choice D, to detorse the testicle and assess its viability. Intravenous antibiotics, choice A, scrotal ultrasound, choice B, analgesia and scrotal elevation, choice C, and ice pack application, choice E, are not the primary.